Thank you, Karen. Okay, so hopefully everybody can see me, everybody can hear me. Good afternoon. For some of you, you may have joined my sessions before. You know that, but let me introduce myself in case you don't know who I am then. I'm Dr. Lanice, and I am actually a faculty member at the University of Texas, San Antonio. I'm a native Texan, born and raised along the border. And my area really looks at young children. My research really is at the intersection of early childhood and bilingual education. So I'm looking at issues of instruction for young children who are learning two languages at school. And we know that a lot of young children are identified at 3 or 4 years old. And so we also have them in our early childhood classrooms with our early childhood intervention services. And so this is definitely a significant topic for us to talk about today. So as you came in, you were kind of typing in the chat where you work, your position. So definitely we have a range of professionals in the group today, and I appreciate that as well. Really, I know that when you do a virtual training, it's so easy to get distracted with something else. So I really just want you to, for the next 90 minutes, really be present. We'll have opportunities where I really want you to participate as a whole group. So I'll ask people to kind of take their mic off and join us. And then we will have some time to do some chat. And then I will have a couple of breakout rooms. And the breakout rooms, of course, are extremely significant that you are present and that you engage, because it is a smaller group and it's designed to give you something to talk about, but it's also a way to process the information that we're learning. And your colleagues are counting on you to be part of that breakout session. So we'll look forward to those. So I want to just start off with talking about the fact that we know that about 15% of young bilingual learners receive special education services around the country. But in Illinois, it's more about, if we look at children under the age of 5, it could be up to 30% of children in Illinois that are receiving special education services. And so we know that many, or oftentimes, children, the issue is often not knowing, is this a language delay, or is this actually an issue of learning a second language at school? And so that's one of the reasons why I think it becomes so significant that we have the conversation. So what do we know? Well, we definitely know that bilingual children may be diagnosed with a disability, and oftentimes are not receiving bilingual services, meaning services in Spanish and English or Vietnamese and English in their two languages. I will say, I venture that Illinois is the same as Texas, that the majority of our special education educators are monolingual, not bilingual, and so that's why children are not receiving bilingual services. We also know that children with a disability, that disability may affect their language development, but it also may not. So we know that a disability may affect their language development in 1 and 2 languages. And we also know that as educators, we often confuse, right, the process of second language acquisition with the presence of a disability. So that's kind of also what I want to talk about today is it an issue of learning 2 languages, or is it really an issue of a disability? And then we also know that, unfortunately, there is definitely a lack of bilingual assessments. And so if I'm not assessing children in their home language, whether that's Urdu, Vietnamese, Spanish, then it is difficult for me to determine their strengths and their needs. So those are issues, right, that we see happening in the field related to children with special needs and children who also may be bilingual. So today I really just kind of wanted to talk about the differences between children with special needs and emergent bilingual children, talk a little bit about identification and assessment, and then the educational strategies and support.
How are you?
So what are some of the differences between children who have special needs and children who are classified as emergent bilingual. So one difference is that children with special needs, their learning develop, they have learning or developmental challenges that may not be related to language acquisition at all. Could be autism, could be ADHD, could be an issue of dyslexia, sensory impairments, but that is a category in itself. And these are children who have, their challenges are not related to language. Emergent bilingual learners, they also have challenges in schools, but they're typically from the fact that they're navigating 2 or more languages in school. And they may be having to adapt to a new linguistic environment that may be in all English with very little supports. And so that is not an issue of having a special need or a learning disability, but more of, I don't have access to education in my home language. Another difference is that children with special needs really exhibit these delays in acquiring their first language. And of course, this may be due to a developmental disability. And emergent bilinguals, they really have a typical pattern of language development. They will definitely acquire English, but the caveat here is that they have to have the adequate support or scaffold for English development and exposure to teachers that are trained to work with them in bilingual education. And we know that for young emergent bilinguals, a lot of times the reason they struggle in the school setting is because they need some time to build proficiency, not just in their home language, but in English as well. And often our school system isn't set up to give them time. So we also know that children with special needs benefit from IEPs, right? That these individualized education plans that are really targeted interventions and accommodations. Whereas emergent bilingual learners, they don't require targeted interventions and accommodations. What they require is rich language environments that are meaningful for them, so they're culturally relevant, that support both languages with the intent of supporting their academic development in both languages. So the reason I talk about the differences is because oftentimes we want to categorize emergent bilingual learners and children with special needs all in the same bucket. But they are 2 buckets, and it just so happens that occasionally, right, sometimes we definitely have children who are dual identified that are in their own bucket of, I am an emergent bilingual, but I'm also a child with special needs. And so then we see that when they're dual identified, that's of course, why we're here today. But I wanted to just pause for a minute and ask if you have noticed any other differences between children. Here's a child with special needs, here's an emergent bilingual learner. Any other differences that that, okay, these are definitely different types of children, even though we want to categorize them as one. So any other differences that you've noticed? And I'll let anybody unmute if they'd like, or you can put it in the chat feature. Okay, so when we are talking about young children who are dual identified, of course, where do we start? And gosh, I don't know if it was, what month it was now that my colleague, Dr. Gonzalez, did a training for you all about working with families, young children and families. And so that's, of course, where we start. We start with the notion that regardless of whether that child is a bilingual child, a child with a special need, or a dual identified child, we always start with this family-centered approach, because we know that the best way to meet the needs of young children is to develop that relationship with families, since they know that child best. So this child-centered approach is significant because it benefits children, not just in the year that you have them or 2 years that you have them, but long-term as well. So when we take a family-centered approach, we think about what practices are you engaging with to develop relationships with families, to learn from them, to ask them questions about the languages that are spoken at home and how their child is engaging at home. We think about a family-centered approach as one where you as the educator are working to build capacity, right? Build capacity. So parents come in with knowledge and skills, but what are you doing at the center, at school, in your setting to continue building their skills and their understanding as a parent? So that capacity building. And then the third one is really this collaboration, that it's a collaboration between the families, yourself, the interventionist, the bilingual educator, so it's a group of professionals that are working together toward the common goal in that collaborative effort. So in this family-centered approach, we talk a lot about it because we know that family engagement is essential, and that as an educator, you have to develop this reciprocal relationship so that you can have this collaboration between the families and you as educators. And again, because it benefits children, families, and you as the educator as well, who is now learning more about family and what they need. So we know that we establish reciprocal relationships with all families because, again, children will ultimately benefit, and these benefits extend far beyond those early years. So reciprocal relationships, that means a back and forth. So again, Dr. Gonzalez discussed this at the last session, and I just want to talk about a few of these to remind you that when you're working with young children, it's imperative that you learn about that child and his family. What is the family? What is their values? What are their beliefs? What are their activities? Because that's going to help you if you're going to develop some accommodations for that child at home as well. And you really have to think about the fact that a lot of children, if we're talking about emergent bilingual children, they may come from a different culture from you, and their child rearing practices may be different from yours. Of course, their culture may be different from yours, but it is important, of course, for us to value and recognize and respect their beliefs, their values, versus being being judgmental about it. And then keeping in mind that together you're working to establish a common goal. So oftentimes what we've seen happening is that the educator comes in with, we know what's best for the child, and so here are the goals that we want to establish, versus having that reciprocal joint collaboration of establishment of goals. And then we remind you that sometimes families who are bilingual families, they may not be used to emails. They may not be used to going to the school and visiting at the campus. That may be something that wasn't part of their schooling experience in their home country, but they may have other issues here, like work schedule, lack of transportation, or today's world, their immigration status, that they may not be wanting to come to the campus to visit with you. So you will have to think about how we're going to reach out to families to provide that support in a non-traditional way. And then the other thing is that oftentimes families have questions. They want to know, should we be speaking to our children at home in English? Or should we continue to speak with them in Spanish? And I'll use Spanish because that's the group that I work with. But we know from research that there are social and cognitive benefits to being bilingual or multilingual. And so that it is significant for you to communicate to families that, yes, we want to maintain that bilingualism. We want the family to continue speaking, singing, reading, including them in conversations in their home language, because that develops the foundation for young children as they're going to acquire English at school. And then again, I kind of mentioned this earlier, that there are going to be some cultural differences. And we just have to acknowledge that that is part of their culture. One of the biggest differences is the way parents talk to children. So some families are very explicit with their demands, and then other families are very indirect. Indirect is the notion that in my home, for example, I would say to my son, you ready to take your bath? It was a question. But the expectation was that the child would say, yes, I'm ready to take my bath, and he would go to the bathroom to take his bath, versus an explicit demand that says, it's time for your bath, go get in the bathtub. And so when the way adults speak to children is different from the way you speak to them at school, that also can lead to some incompatibility. And we also know that there's some cultural differences between the way families take care of their children and give them independence. I will just say for myself, as you know, as Latinas, we have a terrible reputation for wanting to do everything for our young children, particularly boys. And we don't always promote that independence. And again, I'm just really speaking for myself. But again, looking at how do families promote autonomy with young children? How do they promote their agency? What are they valuing, whether it's communal goals and collaboration or independence? And then, of course, you know, family customs, religious beliefs, practices, all of that is cultural differences that when you're working with families, you need to take into consideration. So I have a vignette here. I'm going to say, get ready. We're going to breakout rooms. I have a vignette, and what I'm going to have you do is look at this vignette. I'm going to have you take a picture because you won't remember it when you get into the breakout room. But what I want you to do is talk about it with your group, and then we'll talk about it in a larger group. So let me just kind of, before I show you the vignette, I want to show you that your task, as you read the vignette, you want to think about how to develop a positive partnership with Iris. She's the mother in this vignette, and help her navigate this new understanding of her child because she has many questions and concerns. But the task is for you and your group to determine, after reading the vignette, what do we need to know? What do we need to know before we address the family, and what do we need to do for the family? So here's your task. So let's make sure we all have that. You know, I'm going to show you the vignette in a minute. And you're going to talk about, okay, what do we need to know about this family? And then what do we need to do? So let me show you the vignette, and you're going to take a picture just so that you have it when you get into your breakout room. I'll go through it right now though. So Nayeli is a 3-year-old, and she has just been diagnosed with a disability, and her mom is Iris, and her mom is a bilingual speaker, and she says, "Ahora qué? Now what?" And she's just, you know, what did I do something wrong during my pregnancy? Was I stressed? Is this a test that God has given me? I mean, Iris just has so many questions with the notion, trying to understand that Nayeli, who's 3, has been diagnosed with a disability. And so she starts to wonder, how can I raise Nayeli when I don't know anything about children with disabilities? And what can I do to help her so that she learns like other children? And Nayeli's mom, Iris, asked, should I speak to her in Spanish? Will she be able to learn both languages? Am I capable of raising her without my family living near us? And can her preschool teachers help me? Because we know that families, these are typical questions, and they will come to the educator, you, for questions. So again, before you go into breakout rooms, Nayeli's 3, she's been diagnosed with a disability. It's okay that we don't know what the disability is, but right now we're looking really at Iris, her mom, and her questions. You know, what can I do? How do I raise her so that she learns like other children? Should I be speaking to her in Spanish? Will she be able to learn both languages? Am I capable? And can you as a teacher help me? So the task is, in your effort to build a positive partnership with Iris, what do we need to know first? And then what do we need to do? Okay, so before we get into breakout rooms, let me see if anybody has a question about the task. So Karen's gonna put us in breakout rooms with 5 her breakout room. And I'll let Karen, let me know when she's ready. Oh, there she goes. Okay, so those are opening, and remember that you have to click join to actually go into the breakout room. Let me see, I need to assign. Oh, no, I can't. Let's see. Is everybody joined? The breakout room. Oh, we're missing just Tanya, right? Okay, so it looks like we are back. And let me ask you guys, because we're going to do another vignette in a little bit. Was that enough time? Was it too short or too long?
Too short. We need
A
more.
little short.
It was a little bit too short, but before we even, by the time we all started talking, 2 minutes had passed, so.
Okay, so we'll remember that for next time. Okay, so we know that we're talking about Iris and Nayeli, and we are thinking about how are we going to, what do we need to know and what do we need to do? So anybody want to say, well, in our group, this is what we were thinking. And actually I can stop the share because we're going to talk about it as a class. So anybody can want to say in our group.
I guess in our group, we were first thinking what we need to do in the way of helping Iris to feel comfortable with us, to build a trusting relationship and know that we're here to support her in whatever way we can.
Right, good. So going back to what I mentioned earlier about these reciprocal relationships with families. Thank you, Gina, thank you. Anybody else? In our group, we thought.
In our group, we thought we needed to, it was very important for us to get some background knowledge of the family, to be able to provide resources and be able to know, is there any schooling within the family, how much we would need to find, how many resources we would need to find for the parents to be
Okay,
able to help them.
right. Thank you, Maria. And then I see that Michelle also says we have to figure out the primary language spoken at home. Wonderful. That's also a significant, what do I have to know first? Okay, anyone else? In our group, we were thinking.
In our group, we were discussing, are there any other students within the home that are having language acquisition issues? Do those students also, are they receiving services? And what sort of services are they receiving that, possibly the parent would be a little bit familiar with and can apply to Nayeli's situation?
Right. Thank you, Laura. Okay. And one more, anybody else? And then I'll go back to our PowerPoint.
In our group, we talked about, what a lot of people have said. We also mentioned talking with mom about what her expectations are of what Nayeli could do at that age and figuring out how she learns best and her likes and dislikes within what she likes to interact and engage with.
Right. Okay, thank you. So we're gonna just so what do we need to know and do? Let me get to my slideshow. I keep getting out of it. First of all, you need to kind of consider your assumptions. So it kind of goes back to what someone said about, I think it was Michelle, that we need to find out what language is spoken at home. Talking like Laura said about who else is at home in the family, right? Who else can is part of Nayeli's immediate circle. So really thinking about, because we know that we always approach things from our own perceptions, from our own biases. And so really thinking about, before I jump to a conclusion or make an assumption, let me talk to that family first. So yes, first I really need to talk about their beliefs, right? Let me talk to Iris about her beliefs about disability. And then because we know that every family approaches the notion of their child with a disability differently. And we also need to think about their belief about bilingualism. Like one of her questions was, and I'm going to continue speaking to her in Spanish. So really finding out, if do they speak Spanish at home? Because then I know I need to continue with the bilingualism. And then really finding out their everyday practices and routines, because that, of course, is how parents will work with their young children, is during those everyday practices and routines. And we really also think about the fact that Iris is really scared, right? She has some fear, she has some anxieties. And so you create a space where families can share that with you, can talk with you. And it goes back to, I'm not going to remember whose comment about the helping develop that reciprocal relationship and developing that trust, and listening, right, to families and understanding why they have these fears and anxieties. And then, since we're talking about reciprocal relationships, it's how do we work together to establish goals for Nayeli and to understand the implications of Nayeli's disability and her dual language learning. Like, as a partnership, we need to understand that Nayeli is dual identified. And so what are the implications considering her disability and the fact that she will be learning Spanish at home, and maybe she'll be working with an interventionist in an English setting. And then the reason I talk so much about helping families understand the value of multilingualism is because oftentimes both educators and families, they think erroneously that because a child has been identified with a disability, they should not be receiving bilingual services, or they should not be in a dual language classroom or a bilingual classrooms. And many families, of course, believe that, well, I should say all families want their children to learn English, right? That is the goal for all families. But oftentimes they don't understand that the way a bilingual child learns English is through their home language. So I want to just remind you or inform you, right, that research shows over and over again that there is no indication that bilingualism is detrimental to children who may have a special learning disability or who may have a special need. Because oftentimes when I'm in schools, that's one of the first questions that the dual language coordinator or teacher will ask me is, I have a child who's been diagnosed with autism. He's on the spectrum, and should we pull him from the dual language program? And the answer is no, right? Because we know that when that child receives bilingual services, bilingual intervention, they will actually demonstrate greater growth, right? They're going to learn both languages sooner and stronger than if they just received intervention or were in an all English classroom. So we know that when we work with children in their home language, you build that strong foundation, and it's the foundation that we're trying to continue building upon. So that was, what do we need to know? What do we need to do is, first of all, work collaboratively. We know, so if you think of yourself, if you are a general ed teacher, then you need to work together with the early childhood special education teacher, so that together you're developing their individualized education plans or individual family services plans, because we need the expertise from both the early childhood special interventionist and the general ed teacher. And then the other thing is this: oftentimes the two people in number one here, early childhood special education and general ed, they do not have a background in bilingual education and second language acquisition, right? So the third person on this stool here, for this three-legged stool, is that you have to bring in the bilingual educator, because that person, that educator, has the understanding of, can help you determine, is this a learning disability, or is this a just a ramification of learning in two languages? And then they, of course, because they're bilingual, can also help you work with the families, right? And again, if the bilingual educator comes in and says, this is not an issue of a learning disability, this is an issue of a child learning in a second language, then you know that we do not want to refer them to special education. And then, the reality is there are many languages. And so we may not be able to find a bilingual educator that speaks that language. So we may have to hire an interpreter to make sure that the family understands the process and can actively be involved. one thing we've learned is that when we tell in Spanish, when we tell a family that their child is going to be placed in a special education program, what the family interprets is, oh, we're putting them in a special program. Connotations are very different. Special education means intervention. Special means unique, a beneficial. And so they are very excited to say, yes, you're going to put them in a special program. They're going to receive support. Excellent. And then later they realize, oh, my interpretation was was not what you were saying. So having that interpreter there or a translator to help them understand what does that mean exactly when we say your child will be receiving special education intervention or services. So anything else that you all were saying, well, we also need to know, or we also need to do, like, for example, you said we need to help them get resources. Was there anything else? I'll let anybody say, well, in our group, we also said.
Hello. In our group, we mentioned that, like, for example, I work in a 3 to 5 year old preschool for all program. And when the children are out of the birth to 3 program or coming in fresh to our 3 year old classroom, we usually have a team that does like a screening so we could kind of see where present levels of performance are, that we could be better informed about where the student could be referred or resources for mom.
Right. So you're doing that as well. So, and we're going to talk about early identification and intervention as well, and the screening as well, as we move forward, is this notion that when we think of bilingual screening, right, what do we need to know for bilingual screening? So the first thing is that, honestly, the best way to assess children is in their dominant language, or if you can, in both languages. And again, I realize so many languages that people speak in this country, and we have tests in English and Spanish, maybe Chinese, but that really is the best way to find out what that child knows in both languages, because what they know in one language, they may not know in the second. And if you put them together, though, they know more than you think. So always when we're working with children, again, it's going into either in your school system or into the community to find a bilingual assessor. Notice that it's a bilingual assessor and not just a bilingual person, because this has to be somebody who's trained to give the assessment. So it has to be a trained interpreter, right? Somebody that understands what is the assessment, how am I giving that assessment, and in their language. And keeping in mind that the young child doesn't know that assessor or that interpreter, and so they may be very quiet and not speak as much as if they were with someone that they trusted and felt comfortable with. So because we can't always test children in their home language, then we need to make sure that we're collecting authentic information and materials. So in other words, I need to be sure that I involve the families in gathering information about how the child is using language at home. How are they using it? Who do they speak what language with, right? Like you could say, in our home, with grandparents, he speaks in Spanish. With me, he speaks in Spanish, but with the older siblings, he speaks in English. So really finding out of the language use at home. And then finding out from families what they view as that child's strengths. Because if I can't rely on the screener or the bilingual assessment, then I definitely have to look at more authentic what's happening at home. So what screeners or assessment tools are you all currently using? For some reason I can't see the chat if I'm. So right now, what screener? Let me see. The WIDA, okay, yes. Yep, I see the WIDA. The pre-IPT, okay. Good. I see the pre-IPT. The Brigance, right. The dial, okay, good. So we know then that there are certainly screeners out there that are valuable screeners, but we also know that they have limitations. So ASQ might be one that you're using, the Ages and Stages questionnaire. And regardless of whether you're using the dial, the Brugance, the idea here is for you to understand that for any family, this is a new test for them, a new screener, a new assessment. And so you have to think about how they view the questions through their cultural lens. You have to think about when they read this question, you know, do they understand what we're asking, or how do they interpret that as that question? So you may have to have somebody to facilitate the completion of that assessment or that questionnaire or that screening tool. And then in doing so, you support their understanding of the items. So again, it's, first of all, you make an assumption that the family can read what is said there at a level that is, you know, at the educator level, which is a lot of times we use language that, you know, is particular to education. So you have to be able to, you know, help them understand what is the question and what is it asking. And then, of course, I'm not going to just rely on the screener. I'm going to gather additional information from the family, from other teachers that child may interact with, so that I get a better understanding of where they're at. And then we know that we have to monitor that development over time, because these screeners or assessments are just snapshots of what's happening at that time. So that's why I have to have a more comprehensive evaluation where I'm looking at observations, any product the child has produced, whether it's drawings or, you know, anything that can show me their ability. So use those additional measures. Illinois has a developmental screening, like you said, the dial, the MChat. You may create your own checklist or rating form, or find one that is being used in your area. You definitely are going to want to talk with families and ask them questions, right? And that goes back to how do they use language at home, but also how does that child play at home? Who does he play with? What does he like to play with? And then really observing that child so that the child can demonstrate competence in multiple ways, including drawing, gestures, interactions with other children. Okay, I have another vignette. This one's going to be a little more challenging in the sense that I have multiple questions. And so we're going to look at this vignette, and then because I had each group with a different question, I'm going to come back to that in a minute. So here's the vignette. So Luz and her husband, Luis, they live with their son, Carlos, who's 26 months old. But Luz and Luis both work alternating shifts to care for Carlos. And Carlos has just received the diagnosis of ASD, right? He's on the autism spectrum disorder. And his family, his team, right, is working on helping him use communicative gestures, sounds, and single words. And they're also working to increase episodes of joint attention. So let's go make sure we understand that piece. So they're helping him use communicative gestures, sounds, and single words as they increase episodes of joint attention. So Luz, of course, is committed to helping Carlos learn. And in her family, she says that, well, typically growing up, you know, in my family, we didn't sit on the floor and play with toys. And so, because in our growing up, in our culture, or in my life, adults always worked so that children could thrive. So of course, the question is, how can we support, first of all, Luz and her husband, Luis? How can we keep in mind that Carlos is his own unique little self? And what recommendations can we give to Luz and Luis to help the family increase his communicative gestures, sounds, and single words through episodes of joint attention? Okay, so I'm gonna make sure you take in the picture. And I'm not gonna have a separate task, because these are the ideas here is, how do you support the parents? How do you take into consideration that Carlos is his own unique child? And then what recommendations would you give to the family to help him increase his communicative gestures, sounds, and single words through these episodes of joint attention. Okay, so let me stop the share here. Let's see if there's any questions. Okay. So just like before, before we get into the answer, it's really this notion of talking to the family and addressing what is their preferred language. And then making sure that you use, if their preferred language is Spanish, in this case, Luz and Luis, then making sure that you're using that primary language for visits, bringing in interpreters if you needed to, unless that family is bilingual, then of course, you can use both languages. And then the other thing, and this is, I talked to some of you about, is that remember keeping in mind that Luz and Luis have alternating work schedules. So they're both working. They're not both at home with that child, maybe at the same time. And they don't have a lot of time outside of working, keeping her house picked up and preparing food for her family. So she's got all these things to do. All of you who are, wives and mothers, well, I shouldn't assume house husbands too. We all have a lot of work to do with our families. And so the idea that she says, I can't just sit on the floor and play with them because I don't have that luxury, is something for us to consider. So we want to also think about what experiences have Luz and Luis had with formal systems before? What have been their previous experiences? Have they been positive or negative? Because that also affects how they approach the situation and how they develop that relationship with you. Going back to the notion of developing a trusting relationship. And then also learning from the family about how they feel about a disability or a delay. What do they make of that term disability? Because this goes back to what I was saying earlier, that in education, we throw these terms out, your child has a delay, has a disability, or there's a deficit. So what words, resonate for them, and what meaning do they have? Each of those words have for them? What connotation do they have? And helping parents again work through, what does that mean? And then also in those discussions, always using functional and strength-based language. And I know this is with all children, we use strength-based language, which is why oftentimes when we use the word deficit, we're already coming from the opposite of a strength-based language. So really looking at what words can I use to come from a strength-based language? So one of the questions is, what can you do to help Carlos use more communicative gestures, sounds, and increase those episodes of joint attention? And some of you were right on target saying, you have to learn about the family's everyday routines, because once you learn about their routines, then you gain insight into what kind of learning experiences you can create or help the families create for their children. And because those routines are very, help you understand that family's values and practices, and they also help you understand, when I give you recommendations, I want this to be in a natural context, that it's part of your everyday routine without having to ask you to do something on top of the myriad of things that you have to do. So reminding families that these interactions can happen during everyday routines. So for example, when Carlos is taking off or putting on his shoes, Luz or Luis can make a song about what he's doing, comment on the color of his socks. It goes back to that joint attention, because he's focusing on putting on his shoes or taking off, and you are too with that song. During meal prep, so while Luz is cooking, she could give Carlos materials that she uses in the kitchen, wooden spoons, the tops of pots and pans, and then she can comment on what he's doing, like, oh, you're sure making lots of noise banging on those pots. She can comment on what she's doing through conversational mapping, like, oh my gosh, I'm stirring this big pot. This sure is boiling and bubbling, so that she's using that language with him during that meal prep time. And then, the idea of how you support parents is really acknowledging, this sounds simple, but acknowledging that it's not easy to have that young child helping you cook and helping you wash dishes. Sorry, the allergies over here have been horrible. But just, asking the parents to include that child as much as possible and a little bit at a time. And then reminding parents to celebrate, even if that child could stay present or share your attention for 1 minute, for 2 minutes, whatever the small amount of time is. But the more we do that, we know that that will increase. And then again, this is a team effort. So helping build bridges across all of the people involved in this, whether it's the teachers, the interventionists, or the bilingual educators. So helping make connections and build those bridges. And then we go back to hiring interpreters if needed. And then like earlier, somebody said, making sure that you provide them with either links to resources or the actual resources that they may need, giving them those resources that they may need. And then part of it was, how do you help Carlos? I mean, how do you keep in mind that Carlos is this unique child, right? And so it's just kind of reminding yourself that Carlos has these unique experiences, including his language skills, his interests, and his strengths. And so we have to look at Carlos as an individual versus, all children this age. And then trying to find out, what are his specific interests? What are his characteristics? How does he interact with his family within their cultural context? And then you and families, both together observing Carlos to determine what's interesting to him, what motivates him. Because again, if you want to increase episodes of joint attention, then it needs to be something that is of interest to him so that he is motivated to engage. And then remembering that, or finding out, does Carlos have peers or are there cousins that he interacts with? Because they are also powerful interventionists for young children when it comes to language. So asking peers, siblings, cousins, to ask Carlos to join in physical games, because I know in this part of you didn't see this in the vignette, but Luz does say that he likes jumping. So asking them, include Carlos, and then giving him materials that he likes, right, to help him join them and do what they're doing, so that when they're playing, that they include him in that by giving him those, whatever it is that they're playing with, so that he joins them and engages with them. And then again, it's just to remind you that each of you, depending on your role, is looking at the situation through a different lens. Each of you, whether you're the family or the educator, you're looking at Carlos through a different lens, because your experiences with Carlos are in different environments. So Carlos will behave one way at home, his family, that's the lens they're using, but he may behave differently at school. And of course, we know this is for all children, that the expectations can be very different as well. What's the expectation at home versus the expectation at school? So when working with families, understanding their perspective, understanding that they may be in denial, they may get angry, they may dismiss your observations about their child, and they certainly might need time to process what you're telling them. So understanding that perspective, but also understanding that they're going to rely on you for professional advice, and that you really have to be the advocate for children and their families, because whether it's the law, their rights, recommendations of strategies, and so together you can come up with those goals and strategies. So when you're communicating with parents, understanding again that parents need time, right? They need time to process. Always starting with that strength-based language, keeping in mind that words matter. Like when you say there's a deficit, that has a connotation. Offering those additional resources and support. trusting your instincts. You know, the parent may say, no, the child is this way at home, so I don't necessarily agree with what you're saying, but you're spending a lot of time with that child, so you also need to trust your instincts, but really listening carefully to what families are saying, and then also encouraging them to share their concerns, their fears, their anxiety with you. They may not have anybody else to share that with. And then the other thing is, oftentimes educators approach a child who's dual identified with, well, I don't have the bilingual background. I don't have the special education background, so I don't know exactly what to do here. But remember that this 4-year-old, this 3-year-old is a child first. And you do have the knowledge and skills to work with young children. You do have tools, right, to work with children. So those are some of the same tools that you'll be working with children who have a disability or a child who is dual identified. So kind of giving yourself more credit than you realize as to the strategies that you already have in your toolkit. And then just some kind of cautions is that, remember that we do have over representation of children who speak 2 languages in special education because they're misdiagnosed. So we also have to be careful to consider what's really happening. And we have to be able to distinguish between, is this an issue of language acquisition, or is it an issue of that it's a disability? So being very careful and understanding that sometimes when children are learning in a second language, the behaviors that they exhibit might look like they have a learning disability or a delay, right? But again, going back to when you assess that child, are you assessing them in their home language? Are you gathering as much material as you can? And then are you noticing that the child has challenges across both languages? That may indicate a disability, or is it that the challenge is just when we're doing something in English? So so again, keeping in mind that when children are learning a second language at school, their behaviors may lead you to believe that they have a delay. So that goes back to why you monitor them over time and you collect data from multiple sources, whether that's, you know, observations, other teachers giving you feedback, and of course the families. And then making sure to talk to a bilingual education specialist, because they can help you determine, you know, is this an issue of a true language delay, or is this an issue of just learning it in a second language? And then the thing is that young children who are learning 2 languages at school, they will definitely engage in activities different from their monolingual peers. So let me give you some examples. You may have children who are experiencing what we call a silent period. So that means that in the process of acquiring another language, for some children, it may be their 3rd language, they are just silent, because what's happening is they are listening and processing that information. So they're not speaking yet. So you may think, okay, this child has a delay, but they're really just in what we call a silent period. So the idea then is pay attention to how are they communicating, right? Are they using those facial expressions, gestures, pointing, showing objects, right? Because then clearly they understand what's happening. They're just not quite ready to use the language yet. You may have children who, as they are in the process, mix their languages, right? We know that children will mix their languages. So what that means to you is, I need to let children mix their languages and use all of their language skills, whatever they have in English, Spanish, or whatever language skills they have. And then really focus on what is the child trying to communicate. So if they mispronounce or they use an inappropriate word, that you just recast what that child is trying to say, focusing on their meaning versus whether they said it correctly. So really supporting that meaning making process, and then learning some keywords, right? Just some keywords from that child's home language to acknowledge their attempts to communicate. So just that goes a long way if you can use some keywords from that child's language in acknowledging their attempts. So another one has to do with play. Okay, we've noticed that young dual language learners Sometimes when they're playing, they just are observing. They're reluctant to enter into the play. So again, the adult may think, oh, this child is having trouble engaging with other children, which could be a sign of, you might think a sign of autism. But really, they are just trying to figure out the situation here because it's in a new environment for them. Children are speaking a language they don't understand. So they're just, engaging in onlooker play where they're observing. So they're going to display a variety of play behaviors depending on how comfortable they feel in that environment. So what you can do then is, of course, observe, what is it that they need? Maybe it's just they need time. Maybe they need language support, in the sense that you need to give them the vocabulary. How do I say it? Maybe they need help in making choices. They're feeling overwhelmed when they get to the centers and there's too much materials there and too many things to choose from. And just remembering that they will join in, right, in the activity when they're ready. Okay, so I'm going to pause here to say, do you have any questions about the fact that, yes, I have noticed that my bilingual preschoolers are engaging in activities differently than their monolingual peers. And so that's why I'm not sure of whether it's a language delay or just a natural progression of second language acquisition. You know what, I have to always forget I have the chat feature too. I know, that's why I said that, I'm looking at the chat, that Luce may be the one doing all the cooking and cleaning, and then I said, but I mean, there might be a house husband as well. But definitely, and we also know that, and this is what I tell my brothers all the time, that it is so significant for fathers to read with their children or to engage with their young children, because they engage with them in a different way. And so that is extremely significant. Yes. Thank you for reminding us. Okay, I'm going to keep going then. So remember that limited exposure to English may definitely affect their performance at school. So the idea then is that we have to give children time to develop English and to start making gains in English before we make any special education referrals. I mean, clearly there are some young children that the disability is physical, or it's an auditory or a visual. So there are some disabilities that we know this is an issue of a disability, but there are others that we're just not sure if it's a language delay, a true disability, or if it's just they had not had enough time to develop English and to feel comfortable in their setting. So one of the other trainings we did was strategies that you can use to develop language. These are the same strategies you're going to use with all children, regardless of whether you think they might need an early intervention or not. So the first one is conversational mapping. So I'm going to give you the example. So here the child says, look, arriba, arriba. So he's mixing two languages, but he's also not saying the word arriba correctly in Spanish, right? But the way you recast that and you extend on that is to say, okay, you notice the stick floats on the water, because he's saying it's on top. It has buoyancy. What else do you think will float? So you notice the language that the adult is using. Oh, the stick floats. It has buoyancy. And then ask the question, what else do you think will float? So even though the child didn't say it exactly correct, you recast it and you extend his language. The child may not respond, but he is listening because it's an episode of joint attention. The child says, I see cuadros on the ventanas. So he combined languages. I see cuadros, squares, on the windows. I see cuadros on the ventanas. And you say, you notice square shapes on the windows. Where else do you see shapes? So the child knows that the square in Spanish the word is cuadro, but you're helping them with understanding that the word is square. He knows that that glass on the house is a ventana in Spanish, but you're helping them attach the vocabulary of window. When you recast the vocabulary and you extend the language, and then we always ask a question to continue a conversation. And I see that Lisa is saying that when children are in their silent period, they are able to communicate because yes, they use gestures, they tug, like we want you to come this way. They physically, give you a toy telling you that they want to play with you. And then, yes, Norma, that's why I say using that academic language of like, oh, it has buoyancy. At this point, the child, if you continue to say that, that is the language they will adopt. And I see Amber saying, yes, I do have children who I feel are pretty confident are in silent period. It's very natural. It's a very natural phenomenon when we're learning a second language. The other thing to remember is that young bilingual children are not going to do well in school if they don't have the appropriate instruction or the appropriate support. So the scaffolding becomes extremely important. So you need to make sure that you are providing, effective instruction. So here are just some things that we recommend. That you use as much as possible realia, real objects and sensory experiences where they can use all of their senses, and peers, because peers model what's expected. So here in this preschool classroom, they're brushing their teeth. This is a Head Start. So they're teaching them about brushing their teeth and dental health. And the teacher, each child had their little dental floss. They each had their toothbrush, toothpaste. So you're using all of their senses. And at the same time, you are labeling using conversational mapping the objects that they're using and what it's doing. Oh, you're brushing your teeth. I bet they feel clean. I bet they smell good. So you're using that vocabulary. So when you don't have anyone who speaks their home language, well, you're going to be speaking in English then, of course, but because you're using real objects, oh, you have a toothbrush. The more I say that, and the more I do that in a joint episode, the more they'll acquire that language. And then in the other picture, we see that this is down in Deep South Texas. Farms, agriculture, ranches are very popular. It's very part of the economics of Deep South Texas. So they brought chicks to school. So you see they're both looking at chicks. So this is the idea of engaging in their senses with peers. And the teacher was talking about animal coverings. So this little chick has feathers, and they were talking about the texture and how they felt. They were talking about the beak, and they were talking about being gentle, that they were fragile. And they were using all of that vocabulary. And children begin to adopt the vocabulary because they are experiencing it and they are engaging all of their senses. And it is something that is very interesting and motivating for them. Versus if I had just given them a worksheet, right? The other thing is using visuals, simple pictures. So for example, the one on the left is, here's what you can do if you come to the center, right? You can develop a pattern, you can make a graph, and then breaking down skills into more manageable parts. So here are the expectations to work in a group. We expect you to, we want you to sit in your space. We want you to have nice hands, right? So using visuals with simple pictures and also breaking down skills into more manageable parts so that you can teach them one at a time and not overwhelm them with, too many directions. Like I barely got the first one. The other is using consistent routines and schedules. I think we talked about this in the breakout room. Here, the teacher has, little Velcro to show where they are as part of their routine and their schedule. That's the first one in the yellow. And then on the one on the right, again, it's their schedule. And as they engage in that activity, they take it off from the Velcro so that they know what's coming next. So in this picture on the right, you can see that what's next is snack. And then use of choices for centers with visuals. And all of these pictures, by the way, they are in early childhood intervention classrooms. The teacher is using choices for centers, so children get to choose where they go. And that's what you see the little boy doing. She's showing him the pictures. The pictures are exactly the same that you see on the left-hand side, which is the bigger management plan for centers. And the child who is still not verbal points to where he wants to go, but he gets to make the choice. And the adult is facilitating that communication with visuals and non-verbal gestures, right? The pointing. And let me see what's in the hands-on experiences. Yes, cooking, and using Google Translate, right? If I don't know how to say the word in Spanish, but that, or in this case, Spanish, but that's also why learning just some vocabulary in the child's home language from the family is extremely significant. Using, when we do read alouds, big books, right? With big pictures, visuals, context clues, books that, again, connect to them, that are culturally relevant, that children, you know, yes, I've experienced that, so I can connect to it. So they have big books, and then because of the visuals. Lots of what we call culturally relevant activities. Again, these are activities where children have a connection. So exploring native plants. So they were looking at the parts of the plant. They went outside on the right-hand top, and they were looking for shapes in their neighborhood. So of course we couldn't actually go through the neighborhood, but we went to the perimeter of the school and just looked at, that's where that little boy says, I see the cuadros en las ventanas. I see the squares on the windows, because they were looking for shapes. And then at the bottom, they're looking for animal homes. And you can see the hole in the tree. And they know that animals might be living in there, particularly in our case, squirrels. So this is going back to using like the real object, a sensory-based experience, and peers. Notice they're always with peers. And then we definitely use sentence stems. So we help children with, how do I say it? That goes back to giving me the language. You know, oftentimes child will come to you and say, they just give you the bottle, water in this case, and you say, oh, you need me to help you? You want me to help you? But what we've learned is that you should say, oh, you want me to help you open the water bottle? So that we're providing that whole sentence, and then helping the child say, yes, you know, open the water bottle, versus just nodding. Of course, it's developmental, you know, what they can do at the time. And then authentic writing. I mean, yes, we do expect young children to engage in their own level of developmental writing. You know, these children actually are further along, but we know that all children engage in writing, whether it's scribbles, marks on the page, you know, just circles, but they will engage in that. We do want them to engage in authentic writing. So the thing is that when we work with young children, regardless of whether they are monolingual, bilingual, child with a special need, or dual identified, these strategies work with all children. It's just, excuse me, they work at different levels for children, right? Some children will, you know, advance quicker, right? They're on their scale of development, but I should be using all of these strategies with young children to develop their language and their conceptual understanding. So to summarize, really the idea again is, when I'm working with young children, I must develop a reciprocal relationship with the family by taking a family-centered approach. I have to collaborate with other professionals. So if I'm the gen ed teacher, I definitely need to work with the special education interventionist. But I also need to talk to my bilingual ed or my bilingual teachers to help me understand whether this is a language delay or this is an issue of learning a second language at school. I need to look at early identification and screeners, but I remember that they have limits, especially if we are doing this in an English versus in their home language. So you want to use multiple methods of assessment, which is observation, talking with families, talking with other teachers, to help you have that more comprehensive assessment of the child. And then making sure not to conflate, language acquisition with a learning disability, because we know that children need time. They may be in that silent period. They may just be observing. But if I use effective evidence-based instruction, preferably in the child's home language and English, that, in other words, I think we call it tier 1 instruction. That is extremely significant for helping children, advance in their development. And even if I don't speak the child's home language, and I'm doing everything in English, using conversational mapping, recasting, extending the language through episodes of joint attention makes a significant difference for young children. So you can either in the chat talk about one practice that you think, okay, when I'm working with young children, this is something I need to do, this is something I need to remember. Or in the chat, you could put a question. But the idea here is thinking about, what is something that you really need to consider when you're working with young children that you need to prioritize, or just a question that you might have. Yes, Norma. So you want to remember that the family is a data provider. I like that term, data provider, taking into consideration the family's culture, their values, their beliefs. Yes, we've learned. Don't just say, oh, you want me to open that? But what is it? You want me to open the bag of chips? You want me to open the bottle of water? Yes, big books, because especially if I'm 3 years old, my little eyes, they still don't have the binocular vision. And if the book is too small, I can't see it. The silent period, yes, we tend to there must be something wrong with this child because he's not engaging and talking, but they may just be in the silent period. Using real objects, sensory-based experiences. That's how all children learn, is through those sensory-based experience. So students should be taught ideally in their home language, particularly at this young age. If there's a Spanish-English bilingual program, that's the best way for them to develop English and academics. But we know that there are, in Texas, we have more than 130 languages. So we know that's not always going to be the case. So that's why those strategies of visuals, objects, realia, peers, using their senses is all so significant. Yep. Culturally relevant books, activities, and materials, because that's what that's why children connect. To recast, expand on their phrases. Yes, because that's the thing, is children need to use language as well as hear the language. Yes, and also I see Michelle's comment that, remember that when young children are being assessed, by the assessor, if it's a stranger, they may also be very quiet because they're, this is somebody I don't know. And so they may not use as much language as you would typically have them using in your classroom because they're working with a stranger. So that's why your observations in the classroom are so significant. So Lula, they're using 2 languages. So do you mean like they're mixing them? Because that's also very common as children are acquiring English, that they say some things in their home language, some things in English. And what they say in English, of course, is what they hear at school, quite regularly. Like, it's time to line up, time for lunch, time to go outside. So they start to acquire these English words, and they'll mix the 2 languages for sure. As an adult, I still mix the 2 languages.